Hey, Mrs. Dorsey, how are you doing today?
I'm good. How are you?
I'm doing well. Before we get started, we're going to go over your medical history, okay?
Mhm.
So, I was looking over it, and it says we had a primary care physician.
Mhm.
All right. You didn't mark any conditions down, is that correct?
Yes, that's
All
correct.
right. No medications?
Mhm.
All right. Do we have any allergies?
Nope.
All right. Do you smoke?
Nope.
Okay. All right. Pregnant or nursing?
Nope.
No. Good deal. Alright. Okay. Well, that being said, let's take your blood pressure and get your heart rate real quick, and we'll go from there.
One eternity later.
Okay, so looking at your perio chart that we just did, I noticed a couple things that I want to bring to your attention. So I noticed that on this tooth up here, you have a little bit deeper pocket right there, and there was some bleeding present. Does that tooth ever cause you any problems?
Yeah, it's been hurting for a little bit.
It's been hurting for a little bit? Okay. Um, well, because it had a pocket that's over 5 millimeters deep, so what that basically means is that the pocket between your gums and your teeth and your tooth is a little deeper than what it should be. And that bleeding that's accompanying that pocket can be a sign of inflammation, which can be a sign of infection. So what I would like to do today is apply Arestin to the area. And
What's
so,
Arestin?
good, I'm glad you asked. So what Arestin is, it is a minocycline antibiotic that is locally applied. So what that means is that instead of taking like a pill, like a normal, like a antibiotic a doctor might prescribe you, is that this is delivered in a powder form right to the area that we're trying to get it to, okay? So it is right where it's needed to be right away, okay? And so,
Are there any side effects?
so depending on, if you have an allergy to it, there can be some side effects like a headache, flu kind of symptoms, flu-like symptoms, things like that. But if you're not allergic to it, you should be okay. How we're going to apply that is that we have like a syringe of some sort, and that's the handle for it, right? And we take the cartridge of the Arestin, we plug it into that handle. We're going to, twist it till it locks. We're going to make sure it's nice and, in place. And then I'm going to place that in the area that we want to, that we have those 5 millimeter pocket depths at. And I'm going to place that all around the tooth, okay? And as I place it, it's going to be a powder, right? So as I place it, I'm going to pull it out as I pop it in there. That way I don't, it doesn't just, get shot out everywhere. It stays in that pocket where we want it to be, right? After we do that, some things that we're going to want to do for post-treatment care is for about a week afterwards, for the following week, I just don't even worry about touching that spot. I don't want you to mess with it too much because we want that antibiotic to stay in that pocket, right? And then try to stay away from hard, crunchy, sticky foods. So hard candies, hard vegetables like carrots, gum. Try to stay away from that stuff for about a week. And for up to 10 days afterwards, I don't want you to floss in that area because like I said, we want to make sure that stays in that pocket, okay? And if you do experience some symptoms like you might be allergic to it, go see a doctor, see what they have to say, because obviously if you haven't had any interaction with minocycline before, you don't know if you're allergic to it or not. So, do you have any other questions? All right, cool. Well, I'll get that Arestin ready and we can go from there.
Awesome. Thanks.
Thank you.